My name is Verena Borwinkle, and I'm a neurocritical care physician and brain network research expert for children in disorders of consciousness. And today I'll be interviewing a mother of a patient of mine to discuss the road to recovery. Would you like to speak a little bit about what happened?
In 2018, our son experienced a severe headache at school. We learned that he had a brain bleed caused by a ruptured arterial venous malformation. 4 weeks before our son's stroke, we had lost our youngest son after his 3.5-year journey fighting cancer.
How long would you say that he had suppressed consciousness?
It was definitely for the first over a month that it was intermittent responses or not there at all, or brief times when we'd see positive neurochecks or signs that may have indicated awareness or we wanted to think it was, but there was nothing consistent, low level neurostatus, and his healthcare providers were definitely concerned why he was not as alert as they would hope for at that point in his progress.
Feeling somewhat powerless because we were using everything we could. However, there's one other tool that we kind of had on the bench at that time and we weren't using in the ICU, and that was resting state functional MRI, which we were using regularly for children with epilepsy. So my thought was to offer it to you and the care team as a way of trying to understand what was going on with his brain networks, because as you said, it was so confusing because his consciousness wasn't clear and it was suppressed. And he would have different movements from day to day that were interpreted differently by different care providers. Your son had all of the normal brain networks, which I would not have guessed, and that they were in good condition in this bottom row. This top row showing these abnormal networks look more similar to the children who have severe epilepsy. If all these normal networks were here, then perhaps actually his outcome could be much better than what we would have guessed otherwise by just looking at him. But also these abnormal signal sources mean that there could be a treatment related to them. As the parent, what did this news mean to you relative to everything else that was going on?
It made a big difference for me when I didn't have much to hold on to as far as hope for his recovery, to have a window into his recovery potential. And you let me know it was unknown if he would wake up and recover, but that if he did, all of his normal brain networks were intact. So it was something to hope for and fight for and hope that he could get into inpatient rehab. And you let me know if he could regain consciousness, he would have vision and motor function, language, and something else helpful in that situation, at least an average IQ. You started him on the different seizure medications. And while, yes, it was an up and down path, the next day, his occupational therapist was noticing he was responding more to stimuli. And then he had other fevers and infections that kind of clouded it. But a week later, my son was more wakeful, having more leg and arm movements, and had his eyes open almost all day, which was a contrast to what we were seeing before.
Can you tell us about how you experienced the way we approached these discussions with your family?
Sometimes people weren't as direct about what they were trying to say, which created more anxiety in the situation and uncertainty about what they were saying. So I appreciated when they were more transparent, when you shared with us over time, at one point saying you were perplexed, why was he not more awake? But also the honesty of, we're not sure, will this medication help him become alert, but there is this possibility. And if this doesn't work, we can, in months to come, if he isn't awake, maybe he could have an experimental surgery to help reactivate those connections. And so I think sharing with a parent the full range of information that we have, and then trusting them to know what they want to do to help their child, is the best thing that we can do. Give them all the possible information to make the treatment choices for their child.
What is it that you found was the most helpful?
You want to interact with them and talk with them, but it's very painful to not know. Can they hear you? Can they understand you? Will they recover? Will they have their memories and their personality if you get to talk with them again? I was amazed by his detailed recall of some of his ICU stay, and that we didn't know what he was understanding. And I've thought back that I wish I had advocated for more child life interaction with him, so they have a more comfort and understanding of what's happening to them, just the way we would with a child who was alert and aware.
What else did you find from the healthcare team that helped you as a parent in the room navigating such a difficult situation?
I found that I needed encouragement and support in my exhausted state after losing another child, and experiencing the post-traumatic stress from that experience made it harder for me to cope and learn new skills. And I needed people that were willing to be patient, understanding, work with me on things that I needed more time, allow me to just be mom for a time. But there was a lack of communication at times between healthcare staff, or an awareness of what things that we were not to need to devote our time with at that time. And so a busy ICU setting, you never knew from day to day, was someone going to be pressuring you to learn a new skill that you weren't ready yet to do for your child? Or were they going to be understanding of the recent loss you'd experienced, that you needed time to heal and more time to process?
Can you tell us a little more about the communication challenges that your son faced and what he experienced?
Yes. Finding out that he had good understanding through this time period, but he had a trach and was not able to speak at that time, it became clear that there was a great need for assistive technology, but we were a little bit limited even there with yes, no cards and a letter board, which required him, with still recovering motor skills in his arms, to have to hold his arm up or have it supported to indicate letter by letter what he wanted to say. And the very simplest thought that he wanted to express or share to us, there was a frustration on his part of us not understanding. And so for patients that are in a coma, not being able to know if they're in pain or emotional distress or what they need, I feel that it's important that we have the most technology available to allow them to more clearly communicate their needs and challenges.
Is there anything else that you would like to share with the community out there?
That there is hope for recovery, and there can be a good life after coma, and that this is worth fighting for to help cure coma in our lifetimes. My son was cured from his coma and has a great quality of life and promising future, thanks to the many healthcare providers, his neurosurgeon, Dr. Taryn Bragg, and you, who supported and encouraged me with hope.
And now with us, we have my patient. And so I just want to start by saying that when I first met you, you were 11 years old. Can you recall what in your mind is the first clear memory that you have when you became awake again?
I mean, it's kind of a jumble. I can't really remember the specific order of events that time. I remember a lot of times when like people first started just kind of moving me around, I had a lot of things that I like wanted to say, but wasn't able to say them. I remember blinking was one of my first ways to communicate, just yes or no. Yeah, I think it was 1 blink for yes, 2 for no.
Do you recall having those thoughts and wanting to communicate them, but not being able to?
Yes, I'm definitely remember wanting to share thoughts, and I'm usually quite the person who just likes to process thoughts without talking to people. But it got a bit much since I was there for like all day, every day. I remember it wasn't great because I overthink literally everything. So all that time just staring at the wall with nothing to do, it's not good for me.
Can you recall any of your thoughts that you were having?
I did think about Aaron since he also just recently passed away. I was thinking about like him a lot and sort of reflecting on that.
One of the things that we doctors worry about when someone isn't able to communicate with us but is aware and having thoughts, we worry that you could be in distress.
Yes, I just remember all that time where I literally couldn't do anything and was just sort of in a hospital bed all day. I remember it kind of got really sad staring, just doing nothing. And then even when people did start doing like small things, just like trying to get me on like tilt tables with like a lot of support, just trying to get me to like sort of support my weight, I think.
Mhm.
I remember like I couldn't communicate how I felt about like certain things that were about to happen, and like the therapy I was going through, I couldn't say, yeah, that's a good idea, I want to do that. I sort of did it because I couldn't really do anything else.
Did it feel scary?
Yes, it did. While I was recovering at the very beginning, I couldn't even perform basic tasks like blinking, and I feel like that was extremely distressing for me. It was just worrying about my lack of capability.
What was the evolution of your ability to communicate?
First, just I regained the ability to blink and other basic eye motions, I think. And then maybe I was like nodding. A lot of different assistive technology was used to like help me type with minimal effort. So I could like, because mostly before that point, all I could do was like yes or no, which is great for getting a point across. But if you want to elaborate with anything, can't do that.
And at one point I was rejoicing with you about the skills you had gained. Every interaction was this slow delay at that point in time. I can remember you celebrating back with me, and it was like 15 seconds later, you moved your wrist to give me a fist pump. And when I saw that, I just about cried because it was so wonderful to see you know that slang of celebration, of fist pump, was so awesome, because then it's like your personality is still in there, which was hard to see on your face because your face wasn't yet really even moving with expression at that point in time that we could understand.
Yeah,
Yeah.
even the basic task of just like moving your head, keeping it up, it takes a lot of work. I remember like long days in therapy when I was like just tasked with like trying to like hold my head up. And I remember it would take so much work.
Did you ever feel frustrated?
I definitely felt frustrated again with like my lack of capabilities and stuff like that. Problem is I wasn't really able to communicate it very well. And if I was, it would be very slow. A lot of times I had to communicate by like the only way I was able to, even if it made no sense in like the situation.
Do you recall the process of what you went through to be able to move yourself?
There was always those like weird transfer things where you would like get loaded into some weird hammock like thing, and then you would like go somewhere else.
Did you ever control your own wheelchair, or were all the wheelchair rides us pushing you?
The wheelchair rides were just nurses pushing me.
What could we have done better to make you less scared, less bored?
No one should give me that time with my own thoughts. It's dangerous. I just was so bored of staring at a wall. I know every inch of this wall. My mom, who was sitting there all day, would get up and walk across the room, and I'm like, here's my daily entertainment. People walking across rooms.
Use the word dangerous.
I mean, just kind of general mental health. It's not really a good idea for someone, especially someone like me, who literally likes to explore like every possible choice in every possible situation's outcomes. My mind was basically a big choose your own adventure, like right then.
How old are you now?
I recently turned 15. I'm a freshman. I'm in honors bio. I'm in honors English and honors geometry.
You are the first child to have had a resting state functional MRI while appearing to be in a serious disorder of consciousness. And for myself, it did make me wonder, because you had such amazing looking networks, that you could possibly be aware, or that you could recover and have normal intellect, normal ability to communicate with speech, if we could just get you past this deficit.
This has been fun.
Yeah.